Welcome to Osher Wise. My name is Shelley Adler, and I have the pleasure of serving as the director of the UCSF Osher Center for Integrative Health. Before we get started with tonight's class, I want to take just a moment to celebrate the launch of this Osher Center Community Education Program. Osher Wise, and the WISE stands for Well-Being and Integrative Science for Everyone, is designed to provide the latest information on current and compelling integrative health topics through courses that are taught by leaders in the field right here at UC San Francisco and also across the country. Our goal is to offer accessible, enriching educational content to encourage everyone to become informed, active participants in their own health and well-being. I'm delighted to have you all joining us tonight for this initial course and hope to see you in future ones. And I also want to express our gratitude for the support of the Bernard Osher Foundation, which makes this community education program possible. Now I have the great pleasure of introducing Dr. Natalie Marshall, who is the chair of this course and also the instructor for tonight's class. Dr. Marshall earned her medical degree at the University of Texas Medical Branch and completed her residency in internal medicine at the University of New Mexico Hospital. She then completed a fellowship in medical oncology at Yale New Haven Hospital and later completed the faculty fellowship program right here at the UCSF Osher Center. Dr. Marshall is a breast medical oncologist and integrative lifestyle medicine physician, and she's medical director of the UCSF John Muir Health Cancer Center in Berkeley. She works with patients to modify their habits with the goal of making their bodies less hospitable to cancer growth. And the strategies that she uses include instruction and encouragement regarding diet, fasting, sleep, stress reduction, and exercise. Interestingly, outside of work, Dr. Marshall is a jazz vocalist and lyricist and a Masters Division Olympic weightlifter. So please join me now in welcoming the wonderful Dr. Natalie Marshall.
And thank you for hosting me in this Osher Wise maiden voyage, which I'm really excited about.
Our pleasure, absolutely.
Tonight, I'm going to be talking about movement and strength training to improve metabolic health. And this is a really important thing because there's different chronic diseases. They have some commonalities in metabolic dysfunction. And one of the things that people can do is to exercise, move, and do strength training to improve metabolic health. And we're going to go through, the metabolic health at first. But then I want to talk about what people can do to improve their health. And this is my disclosure. I'm a co-founder of Survivor Strong. And the learning objectives for tonight are to learn about metabolic health and fitness, metabolic fitness, to understand the relationship of movement and overall mortality, to discover the effects of exercise on cellular health, and understand the causes of sarcopenia, which is low muscle mass, and the importance of body composition. And then I want us to find out how much and what type of movement or exercise is enough. I think you're going to be surprised at how much is actually enough to improve your health, and to discover how strength and resistance training can be for everyone. So my first thing I want to talk about is metabolic health and metabolic fitness. And what do we mean by that? Metabolic fitness is defined by the following parameters: blood glucose control, blood pressure control, cholesterol and triglyceride control, and the presence or absence of the metabolic syndrome, which I'm going to go over in a second. These factors, glucose, blood pressure, lipids, cholesterol, the metabolic syndrome, these factors have an important and common role in the prevention or the causation of chronic diseases, such as diabetes, cardiovascular disease, Alzheimer's disease, or cancer. So what is the metabolic syndrome? It is meeting 3 of the 5 3 of the 5 criteria below. So if you meet 3 of these 5 criteria, you would be diagnosed with the metabolic syndrome. And this would be like visceral obesity, high blood pressure, insulin resistance, which means that your sugar levels are running high, so your insulin levels are running high, and maybe your insulin is having a hard time keeping up with how high your sugars are running. So insulin resistance and or diabetes, high triglycerides, which are fats in the blood, and low good cholesterol in the blood. So what things can affect metabolic health? Stress, because stress can raise your stress hormones and inflammation in the body. Your diet, because that can change blood sugar and cholesterol, triglycerides in the blood. Sleep, and sleep is really interesting because if you don't sleep enough, it can raise your blood sugar, and that in turn raises the insulin level, and it changes the hormonal control of hunger. So not sleeping enough can affect your metabolic health. Medications can affect blood sugar or cholesterol and triglyceride levels for the good and the bad. So for instance, if you're taking a statin, it might lower your cholesterol and triglycerides. But if you're taking an aromatase inhibitor for breast cancer, it might raise your cholesterol. So medicines can be good and bad. So can supplements. Supplements can also do different things to blood sugar and cholesterol. Fasting, of which there's many types, can change blood sugar, cholesterol, triglyceride, and markers of inflammation. But today, what I really want to focus on is exercise and movement and muscle mass and body composition. So that's what we're going to focus on, is those things in relationship to metabolic health. So what does exercise do? It lowers the blood pressure. It stabilizes the insulin and the blood sugar levels. It improves mood and sleep. It increases caloric burn. It fights osteoporosis. It helps with bone strength. It cuts the risk of heart disease and strokes and improves cognition and lifespan, as well as health span. So these are the health benefits of regular physical activity. These are the things that have been studied in randomized controlled trials and observational trials to lower the risk of all of these different conditions with regular exercise. So overall mortality and movement. I want to introduce the concept of epigenetics. And what epigenetics is a field that is looking at how environment affects our genes. So we are not destined to be sick. The influence of environment on our genes is what epigenetics means. And there's a saying that genes load the gun, but environment pulls the trigger. And a lot of different people have claimed that they said that first. So I'm not putting it to one person. I'm not giving one person credit, but it's a really interesting way to think about how our environment affects our genetic makeup and whether the things that we do can help us get a disease or avoid a disease. So food and exercise, sleep and stress, trauma, supplements, mental health, toxic exposure, the list goes on. All of these things can influence if a disease is manifested or not. This is a slide that I like to show because it shows graphically the relationship of sitting with all-cause mortality, sitting and also physical activity. And if you look up in this upper left-hand corner, the daily sitting time as it goes up without movement or exercise, the overall mortality rises. So in the red is the highest overall mortality. This person, if they started to exercise, would move across the screen and go into the yellow, which would be a lower overall mortality. Where we want to really be is over in the green. So the more that you exercise, the lower the overall mortality. And even if you sit, if you exercise also, you can decrease your overall mortality by activity, even if you sit a lot. So this is a study that was done published in the Annals of Internal Medicine, looking at sedentary time and its association with the risk for disease incidence, mortality, and hospitalization in adults. And this is an important study because what it was looking at is the risk of overall mortality, cardiovascular disease, and diabetes in relationship to sitting time and sedentary time. And what it shows is that for all of these different studies that were done, so each one is a different study for all-cause mortality, diabetes, or cardiovascular disease, it showed that increased sitting time increases the overall mortality, the diabetes risk, and cardiovascular disease incidence. And I'm going to just show you this way that we look at risk. This line in the middle is called the hazard ratio. This is a hazard ratio graph. And the line in the middle means that there's no effect. If the effect turns out on the left, it means it's a lower risk. If it turns out on the right, it means it's a higher risk. And so for most of these studies, sitting time, sedentary time, increase the risk of these different outcomes. So prolonged sedentary time was independently associated with deleterious health outcomes, regardless of physical activity in these studies. And this is also another hazard ratio. If you look here at 1, that would be no effect. So people that didn't move and didn't exercise, they had kind of no effect at all. But patients that exercised even a little bit, the more that they exercised or the more that they moved, the lower the hazard ratio, which means that they had a protective effect from overall mortality. So even brief periods of physical activity, as little as 2 minutes an hour, can confer a survival benefit. And the risk of dying prematurely declines as people become more physically active. So you can see in this graph that as the minutes per week of moderate or vigorous activity go up, the risk of dying goes down. Now, interestingly, in this curve, and another one that I'm going to show you later, the biggest benefit is seen from people that go from doing very little to doing something. And then the curve kind of flattens out. So it's important to know that even if you can't do a very large amount of exercise, a little bit of exercise does lower your risk. And this is physical activity in relationship to cancer. And I'm a medical oncologist, so this is really important to me. And I talk to my patients about this, but I like to tell the general public this as well, that physical activity lowers the risk. Again, this is a hazard ratio. You see the line where there's no difference, there's no change in risk. And you can see that on the left, for all of these different cancers, until you get down to the bottom, there's a lower risk of getting a primary cancer of these types if someone was physically active. And the only one where it's really not shown to be the case is malignant melanoma. And we think that that's because patients that are active, they're oftentimes outside in the sun, and maybe they get some more sun exposure. And so maybe that's why it doesn't protect them, is they have more sun exposure, and melanoma risk thus. And these are the cancers that have the most evidence of lowering risk of getting a primary cancer: colon, stomach, esophagus, bladder, kidney, endometrial, and breast cancer. And then they also know that in cancer patients, exercise during or after cancer treatment can decrease side effects like fatigue, anxiety, depression, physical function. And it also can help people that have breast cancer. It can prevent or decrease lymphedema if people exercise. And then for cancer survivors, prostate, colon, and breast cancer specifically, it lowers the risk of recurrence if a patient has a cancer and exercises after a diagnosis. So how does exercise work this metabolic magic? This is actually super interesting. So I want to just go over this concept of free radicals, antioxidants, and oxidative stress. And free radicals are molecules that are missing an electron. So like this one on the left that's in red, this is a free radical and it's missing an electron, which what that means is it has a negative charge. So it wants to come back into balance and get rid of that negative charge. So if it's in your body, a free radical will swipe an electron from a normal cell. And this causes what they call oxidative stress in the cell. And the cell starts to decay and age because it's the free radical is damaging it by stealing its electrons. So antioxidants, what you see on the right in green, are compounds and molecules that have extra electrons to give. And so when you mix an antioxidant with a free radical, it will give the free radical the electron. It'll donate the electron, and that way the free radical doesn't damage the cell. Well, interestingly, exercise increases the number of these antioxidants in cells, and then it helps to fight oxidative stress. This is a cartoon of mitochondria, and mitochondria are the powerhouse workhorses of our cells that make energy for us. They make ATP, which is our energy that makes our cells function. So exercise pumps blood to the heart, brain, muscles, organs, bones. Mitochondria in all those tissues make energy from oxygen and nutrients, and it makes energy and waste products called free radicals. So it's normal to make free radicals from just metabolism, but your free radical load in your body can get too high if you're sedentary, if you smoke, if you're depressed. Actually, depression and stress can raise free radicals in the body, toxins or radiation exposure. And what happens is if you're just exercising and you make free radicals, exercise increases the antioxidants and that can, basically neutralize them. But if you're not exercising and then you're exposed to all these things on the right, toxins, unhealthy food, stress, etc., then this can overwhelm the mitochondria and the free radicals can cause accelerated aging. One of the cellular benefits of exercise is from increasing antioxidants in the cell to counter the free radicals. So moderate aerobic exercise or HIIT training, which is called high intensity interval training. When you have moderate aerobic exercise or HIIT, it causes a brief stress response. This triggers a bigger restorative response. And exercise, though it damages some molecules and the damaged molecules lead to inflammation, it's short-term good inflammation where the exercise induces autophagy. And what that is when the body will eat up the damaged molecules, it will increase the number and quality of the mitochondria in the cells. And overall, on balance, it reduces oxidative stress and it makes the body healthier and more cleaned up than before exercise. Now, HIIT, for anyone who doesn't know what that means, high intensity interval training is when you do short bursts of heavy exercise like running fast or riding the bike really fast or rowing really quickly or walking really fast. And then after maybe a minute, you slow down and walk at a normal pace and recover. And it's these brief bouts of intense exercise followed by lower intensity exercise to recover your heart rate and recover your breathing. It has a very good way to increase mitochondria number and quality, and it can make this big restorative response within the body to help clean up damaged molecules. So exercise improves metabolic fitness by lowering stress and stress hormones, decreasing belly weight gain, and decreasing high blood sugar. And the way it does this is that high cortisol and stress hormones, they can cause elevated glucose, and then that causes elevated insulin. It can dysregulate sleep. It can dysregulate your immune system. Exercise kind of tamps down the stress hormones. causing less release of the stress hormones. And so then those effects are less prominent or not at all there. Regular exercise makes cells throughout the body more sensitive to insulin and can also, the muscles, especially your skeletal muscles, the big muscles of the body, they can also directly take glucose into the muscle without even needing insulin. So it's another way to get the sugar levels in the body down and help the person not be pre-diabetic or diabetic. Now, I want to talk about how exercise helps telomere health. Telomeres are the caps that are on the end of our chromosomes. And these are, they kind of like talk about them as like the caps that are on the end of shoelaces. They keep the shoelace from fraying. These are caps that are on the end of our chromosomes, and they basically help the chromosomes stay intact and being able to divide in a functional way. Now, as we age, the caps, as you can see going left to right, the caps get smaller and smaller until they can actually even not be there at all. And as they shorten, the patient's mortality rate goes up. So as you age and you're going towards the end of your life, your telomeres are going to be shorter. But exercise is one of the things that lengthens telomeres, which slows this aging process. And so it doesn't go as fast if you're exercising because it helps repair the ends of the shoelaces or the ends of the chromosomes. So exercise helps our telomeres by reducing oxidative stress and inflammation, increasing telomerase. This lengthens and repairs the telomeres. The telomeres don't need extreme exercise to thrive, and they respond to many forms of exercise and many levels of exercise. Now, one thing that the experts in telomeres who actually discovered them at UCSF and did a lot of the seminal work is that chronic overtraining, like people that train too hard for exercise, this can actually cause damage to the telomeres. Now, most normal people are not in danger of overtraining, but that is something that they do know. So now I'm going to go to the next thing I want to talk about, which is senescent cells. They're also called zombie cells. And I kind of love that you're calling these cells zombie cells because it kind of gives you a good idea about what they do. These are cells that get damaged, but they don't die. So maybe their DNA got damaged, or maybe they got radiation exposure, or maybe the mitochondria got a toxin and they got poisoned. Or maybe there's a medicine that they got exposure to, or maybe it's because there's just shortening of the telomeres and aging, and they're just not repairing themselves right. But they get damaged, but they can't repair themselves, and they don't die. And in order not to become cancerous, which the body tries not to make cancer whenever it can, in order not to become cancerous, it stops dividing, but it's only like half alive. It's like half dead, half alive, like a zombie. And it's metabolically active. And that's the really important thing about it, is that it's metabolically active and it secretes chemicals which create inflammation in the tissues nearby. And so these zombie cells, they can affect other organs in the body, including the muscles, and they are a big contributor to muscle wasting and sarcopenia, or low muscle mass. And so you can see in this cartoon, the white blood cells are coming in because they're secreting all these chemicals. So the white blood cells come in, there's lots of inflammation, and then all that inflammation can affect the brain or the heart or the liver or the muscles. And these senescent cell signals can influence disease in the other parts of the body through these chemical messengers. So this is another way to look at it. The senescent cells are causing or worsening atherosclerosis or dementia, or metabolic diseases like the metabolic syndrome, fatty liver, diabetes, kidney problems. And this would be like another way to look at it DNA damage to the cell, the telomeres are eroding, the mitochondria stop working, and the cell kind of becomes unable to die, but unable to live. It's just like a little nasty little zombie. So next I want to talk about sarcopenia and body composition. So what is sarcopenia? Sarcopenia is low muscle mass. And if you look at the left-hand side, if you look where the purple line is, this is like normal muscle mass. Like if this whole thing was solid muscle from the purple line all the way around. Patients, as they get older, can lose muscle mass and with certain diseases. And maybe they would have some mild muscle loss, but they can also have severe muscle loss where in the blue, like that might be all the muscle they have. Or the green would be like, sarcopenia, but not severe sarcopenia. And if you look at a cross section, this is like a cross section of the leg. And if you're looking at a healthy muscle, all the red is muscle mass. And then there's the body's, subcutaneous fat. In a sarcopenic patient, you can see that the muscle mass is very low. And because there's not that much muscle, it gets replaced by fat. If you look at the size of these two thighs, they're about the same. But the body composition is different because this has a lot more fat and a lot less muscle. And this is like a healthy muscle. And this is what a sarcopenic muscle looks like. And you can see that it's much smaller than a normal sized muscle. So sarcopenia is a sign of metabolic dysfunction and metabolic disease. It's common in patients with chronic diseases like diabetes, cancer, cardiovascular disease. It's common with aging. So somebody who's 95 is going to be more sarcopenic than somebody who's 25. And interestingly, it's independent of your body mass index. So you can be heavy and be sarcopenic, but you can also be skinny and be sarcopenic. You can have a low BMI and be sarcopenic. People that are sarcopenic have a higher chance of hospitalization, a higher chance of falling, and it's an independent predictor of overall mortality. On the right, I'm going to show you a couple ways to look at body composition. One way was we were looking at the thigh, but this is like two people that weigh the same amount. They weigh exactly the same. They're the same height. But if you look at their composition, this patient has 35% muscle mass, 15% body fat. This patient has 35% body fat and 15% muscle mass. Very different metabolically for that patient. So the causes of sarcopenia are variable. Inactivity is a very big one. Metabolic syndrome is another. Diabetes, poor diet, like if you have a low quality diet or inadequate caloric intake. Stress can really affect your metabolic health. Cancer and cancer therapies, people that have liver, heart, and kidney disorders, genetics, smoking, and excessive alcohol. And I want to just show you two slides about sarcopenia in cancer patients. So this is a study done at Kaiser where they looked at patients who were diagnosed with breast cancer, and at diagnosis, before they were treated or anything, a third of them were sarcopenic. And those patients that were sarcopenic had a worse overall survival. This curve on the bottom, the orange one, shows their overall survival was worse, independent of their BMI and independent of their treatment, the ones that had low muscle mass when they presented with their diagnosis. The same thing was seen in colon cancer patients, that patients that were sarcopenic had a lower overall survival. And this was also seen in patients whether they had high body fat or low body fat and high muscle or low muscle. And the patients that did the worst were the ones that had high body fat and low muscle mass. But the patients that had low muscle mass did worse than patients that were just heavy, had high body fat. So if you have high body fat, but you have muscle mass, that's more healthy metabolically. It's not just about how much you weigh or what you look like. It's actually what you're made of. It's what your composition of your body is. And this is another way to look at it. So this is a CAT scan slicing through the abdomen. These are two people with the same BMI, body mass index, which is a measure of your height and weight. A lot of doctors use BMI to decide if a person is heavy or not, is too heavy or obese. But BMI is an imperfect way to look at your body because these two people have the very same BMI, but this patient has a lot of muscle mass. If you look at the red, that's muscle, and not as much adipose tissue in the visceral area. This patient has a lot of fat around their internal organs or visceral adipose tissue and less muscle mass. And interestingly, in their muscles that they have, they've got fat going through the muscle, kind of like marbling of a steak. And this is also metabolically very unhealthy. And so intramuscular fat infiltration, which is what we just looked at in that previous slide, this is a slide looking at people's thighs. This is a sarcopenic patient. You can see that this person has way more mass, more muscle mass. This one has less. And the quality of the muscle is also lower because this one has fat infiltrating throughout the muscle that they do have. So intramuscular fat can be a storage compartment for the body. For obese, insulin resistant, or diabetic patients, they can, in trying to get rid of the glucose in the blood, they can convert that glucose to fat and store it in the muscle or store it in the liver. And storing it in the muscle right here as a storage compartment is a way to deal with that, but it's also very unhealthy because then there's a lot of inflammation in the muscle, and this can impair muscle function. Now, something that's interesting about intramuscular fat is that in exercise-trained individuals, there is some fat in the muscle that the body uses for energy, for endurance training, endurance exercise. But that's that's for people that are very high intensity endurance trained athletes. But this is not a good thing to have, this intramuscular fat infiltration. So what does muscle do for us? Muscle exercise helps us build muscle mass. And then muscle, it's not just sitting there in our body. It's actually making chemicals that talk to the rest of our body. So it makes these different chemicals, and it also shuts off the crosstalk of the fat cell. So these are fat cells. They make chemicals that talk to the body and can make the patient unhealthy. Muscle and exercise turns on these chemicals that tell the fat cells to stop sending out bad signals. And these different chemicals can help with decreasing inflammation, muscle regeneration, using fat for energy, and making the patient more metabolically healthy. So muscle is really a secretory organ. Muscle contraction can stimulate the production of different myokines. That's the chemicals that the muscle makes, muscle being myokines. And these act as stimulators to distant organs. And that's why people that have low muscle mass and sedentary lifestyle have a higher risk of these different diseases: cancer, dementia, cardiovascular disease, diabetes. And people that exercise and have activity and turn on these good chemicals from the muscle, that can help with bones, liver, immune function. It can help with neuron survival and brain function, and can help with insulin sensitivity so that the person isn't diabetic or has a lower chance of being diabetic. So myokines and adipokines, actually, I'm going to show you one crazy slide. This is the chemical crosstalk between fat cells and myokines. So I think of it like politics. It's kind of complicated. There's a lot of crosstalk. And I don't want you to like know all these, I'm not trying to show you these different things in specifically, but just to show you how complicated it is, what the fat cells make, what the muscles make, how they talk to the rest of the body. So this is a simpler slide showing that when people exercise, it turns on all of these things, these good green ones. And this helps with protein synthesis and building muscle mass and metabolic health. When a person is not exercising or is sedentary, then all of the good things go down and all the bad things go up. And this causes protein degradation in the muscle. And they think that is why people get sarcopenic, is that these different chemicals that are kind of a push and pull between the fat cells and the muscles are the fat cells are basically winning the war in this cytokine war. So I want to mention one of the myokines that's really the MVP of exercise-induced myokines. It's called Irisin, and it's a regulator of energy metabolism. It decreases diabetes and obesity risk. It enhances cardiovascular health. It decreases depression. It very interestingly, and the neurologists are really interested in this, it increases this thing called brain-derived neurotrophic factor, which increases cognition and brain health. And it protects against bone loss and sarcopenia. But all forms of exercise increase irisin. HIIT training and resistance training seem to increase it the most, but even small amounts of regular aerobic exercise or walking, moderate exercise can increase irisin. So there's a couple of things I want to talk about dietary considerations and body composition, because there's a lot of information out in the public space on the line about what should you eat, should you fast, what kind of, should you be paleo, should you be keto? There's so much information, much of it misguided and maybe doesn't apply to everyone. And so I want to just go through what I feel is best for considering body composition support and the things that have evidence. So starvation or high-fat diet, high-fat feeding can increase intermuscular fat, the marbling in the fat that I talked about. High-fat feeding in sedentary patients decreases insulin sensitivity and glucose tolerance. So if you're not exercising and you're eating a really high-fat diet, this can make you more diabetic, more prone to diabetes, more prone to insulin resistance and higher sugar levels. Saturated fats from animal products can increase insulin resistance. Now, unsaturated fats like avocados and olive oil, they don't seem to do that the same way that saturated animal fat does. Now, one of the things I really wanted to say was about this popular 16-8 intermittent fasting. There have been multiple studies that have shown that in adults, it lowers muscle mass. And so if we're trying to help our body composition and have more muscle mass, then 16-8 fasting is not a good thing to do as an adult. 13 hours of overnight fasting has not been shown to lower muscle mass. So 13 hours of fasting could help with the metabolic, healthfulness of fasting without compromising muscle mass. And then the popular weight loss drugs, GPL1 inhibitors, they lower muscle mass also. You lose weight when you take those medications sometimes, but you lose 50% muscle, 50% fat. And so that's not also good. So people that are taking those medicines need to be doing exercise and strength training. So what you eat and when you eat it matters for preserving favorable body composition. So how do we affect body composition and increase our muscle mass and hopefully decrease our adiposity, which means our fat mass? But we really want to focus on how do we increase our muscle mass. Strength training increases lean muscle mass in relationship to fat mass. So it's going to increase your muscle mass the most of any type of exercise you can do. Aerobic exercise does help body composition by burning body fat, but it also does strengthen your muscles. Adequate nutrition, adequate but not excessive amounts of protein, avoiding fasting for more than 13 hours, stress reduction, because stress If you're really stressed, like I mentioned earlier, your stress hormones get activated, and that can cause sarcopenia and muscle mass loss. And then adequate sleep is also really important for rest and repair of muscles. If you're strength training or you're exercising, you need to get adequate rest so your body can repair itself. And, you know, when we talked about free radicals and we were talking about how the antioxidants are made when you exercise in the cell, you need to rest for it to do the autophagy and the cleaning up of the damaged molecules. So rest is really important. So now let's shift to talking about what opportunities do we have to improve health? And I want to make sure that tonight I'm telling you about opportunities for anyone, even a person that's in a chair, even a person who can't go for a walk outside for 30 minutes, like the guidelines say. You can still move and it can still help you. So the relationship of moderate to vigorous exercise with all-cause mortality. We had a little slide earlier that I showed you that the benefit is steepest, is best for patients that go from doing nothing to doing something, okay? So patients that start to do anything at all compared to nothing, they can get a very big payoff, big benefit. And it keeps going down. So you get this big benefit till you get to around 150 minutes, and then it just starts to flatten off a little bit. Now, does this mean you shouldn't exercise more than 150 minutes a week? No, it doesn't mean that at all. If you like to exercise, if you want to exercise more, you can. But 150 minutes a week is really the amount where you get like the most benefit from doing nothing down to 150 minutes a week. Now, the guidelines say 150 to 300 minutes a week of moderate intensity exercise. And as you can see, when you get back down here, doing a lot more than that doesn't necessarily decrease your risk of dying. Now, it could have other great benefits for you, but if you're looking at the mortality benefit, going from nothing to doing something to getting to round here in the sweet spot, that really is what you need to try to do to get the best benefit. And these are the physical activity guidelines for Americans. It's at least 150 minutes a week of moderate intensity aerobic activity, muscle strengthening activity twice a week, and then mix in activities to improve your balance. So activities like dancing or sports or Tai Chi or yoga, things that help you with your balance are important as you age too, because then you're going to be less likely to fall. I like this because it says walk, run, dance, play. What's your move? You have to find something that you like to do, but moderate intensity 150, 2 episodes per week of some type of strength building exercise. That doesn't have to be weights. I'm going to talk about that in a minute. And then something that challenges your balance. So the 5 components of fitness are cardio, balance, strength, stretching or flexibility, and rest, because you have to rest your muscles so they can repair. And I really want to stress to start wherever you are and work to approach the guidelines. But if you can't ever do those guidelines, but you're doing something, it's better than doing nothing. And this is the way that people organize like a exercise prescription. Maybe a doctor would give this to a patient. It's called the FITT principle. It's frequency, intensity, time, and type of exercise. So the frequency is the days per week. The intensity is whether it's light, moderate, or intense, measured by the song, I call it the talk seeing test. I kind of said that wrong, but I'll show that to you in a moment. Time, the amount of hours per week of exercise, and whether it's aerobic or strength building exercise. So how much is enough? Movement in any amount is good. Sitting is like smoking for overall mortality. We saw how people that don't move and sit a lot, they have a higher risk of dying. And if they do even a little bit of activity, they can decrease their risk of dying. So small amounts of exercise benefit everyone. These health benefits occur in children, adolescents, young and middle-aged people, adults, older adults, in every racial and ethnic group studied. Exercise also improves metabolic health, and that is independent of weight loss. So even if you don't lose weight, exercise helps you. So how do we get started? I want to tell people, if you're not somebody who's been exercised, you want to start, your activity should be increased slowly and steadily. And inactive people should start with low intensity exercise and steadily increase the volume and the intensity slowly. Appropriate protective gear should be used. So like good shoes, if you're going to be walking, you shouldn't be like trying to take a brisk walk in flip-flops because you might twist your ankle or something. And physical activity should be conducted in a safe environment. Symptoms of undiagnosed or uncontrolled disease should be evaluated by a health professional prior to initiating exercise. So for instance, if you have chest pain, shortness of breath, if you have episodes when you feel like you're going to pass out or dizziness, you should be evaluated by a health professional before you start an exercise program to make sure you don't have something that's going to put you at risk for a heart attack or a stroke. And you don't want to be exercising if you haven't been checked. So everybody talks about 10,000 steps. So where did that come from? That was based on research from a Japanese physician, Yoshiro Hatano, and he studied older Japanese people, and he looked at how many steps did they do per day. And there's a large number of patients that live to 100 in Japan. And so he was looking at how much do they move per day. And the average that these older patients moved was 7,500 steps, somewhere between 5,000 to 7,500 steps. So there was a whole movement around getting steps and measuring steps. And the International Longevity Center promoted this walk to a healthy future, trying to get people to get 10,000 steps a day. And the really great news about this is it only requires good walking shoes and a pedometer or a phone. Many people have those tools where they can measure how many steps they're getting. And this is another thing when you're doing cardiorespiratory exercise that's important, and that's your rate of perceived exertion. We call it the RPE. And this is you determining like how hard is an exercise. If you're going to do moderate intensity exercise, you want to be, making sure that you're going to, you don't want to go so hard that you can't breathe or so hard that you feel like you're going to pass out or that you couldn't talk at all. But you want to be, if you're healthy, you want to be trying to increase your cardiovascular exercise and move it into a range where it's moderate to intense. And so in this scale, looking at this scale, if you're somewhere between 5 to 7, that would be moderate intensity exercise. And on this other scale, like a 13 to 15 would be moderate to heavy exercise. I kind of like this scale because you can visualize it. Okay, I'm a 7 or a 6. It's kind of easier, 1 to 10, for most patients to kind of see their rate of perceived exertion. So when I'm rowing on a rowing machine doing HIIT, I'm at like a 10. But if I'm walking around my neighborhood, maybe I'm a 6 or 7 if I'm walking fast. So cardiorespiratory training, what we recommend is 20 to 60 minutes of continuous or intermittent exercise, 3 to 5 days per week. And you want to try to get up to that moderate intensity. Now, if you can't do that, 5 minutes of walking at a smaller pace is fine. You don't have to start off doing this. It's just a goal to work towards. And I love this, the talk sing test. What intensity are you working at? If it's light, is if you can sing a song. If it's moderate, you can talk, but you can't sing. Like these ladies that are walking with each other. They can talk to each other, but they can't sing a song. Or intense, this guy who's swimming. He can't carry on a normal conversation. The benefits of strength training: lower insulin more than any type of exercise, so that lowers diabetes risk. It's the best way to increase muscle mass and decrease sarcopenia. It improves relative muscle strength to help you do aerobic exercise. And it helps people with coordination, balance, bone strength, flexibility, and tendon strength. It also improves quality of life because people can do more things and lowers the risk of fractures and falls and being placed in a nursing home. So strength training, there are options for everyone. You can do body weight exercises like push-ups, squats, lunges, plank, side plank. There's options for exercise in the chair. You can do yoga on a mat or on a chair. You can do Pilates, and you can do weight training. And weight training, you want to be training all the major muscle groups if you're doing strength training with weights. And this would be like pushing and pulling exercises like push-ups or pull-ups or chest press or row, deadlifts or hinging, squats. There's all different kinds of weightlifting exercises, and there's ability to scale them to any body's ability. There's this great thing called the Key 3, which if you don't know where to get started, this is a great place to start. And this is, you could do this even without weights, just laying on the ground doing a chest press, like this man on the right. This is a row where he's pulling it up next to his body. And this is a squat where he's squatting against the wall and holding the weight. But you can also just squat against the wall without the weight. You don't even have to use a weight sometimes if you're not trained yet. There's also mind-body movement practices like yoga, tai chi, qigong. These are body weight strength training, balance training, and they also help with flexibility and mobility. So these are good choices for people who maybe don't want to lift weights, but they want to connect to an activity that decreases anxiety, depression, fatigue. Maybe it has a meditative component. And these are complex practices. They're similar to how if you eat the whole plant, it's kind of more complex and maybe has more benefit than if you eat like an isolated compound from a plant. So if you eat turmeric root versus you have a pill of curcumin that you take, turmeric root will be a much more complex and possibly more beneficial. That's these mind-body practices for strength training can be really good for people because they work on multiple angles at the same time. And yoga has been shown has been studied in diverse populations and has good evidence for improving bone strength, muscle strength, mobility, stress, anxiety, sleep, and fatigue. So exercise snacks is something that I'm going to do with you in just a second, but exercise snacks are small strength training and aerobic exercises that you can do throughout the day. These are great to do as taking a break from sitting. They might be wall push-ups, chair squats, a 5-minute walk. These are small amounts of strength training that help people build confidence to do more. And exercise of any type can improve energy, motivation, and mood and get you into a victorious cycle. So let's try some exercise snacks. Now, hopefully everyone can see me. Okay, I hope you can see me because I can't see you. So we're going to start off with an exercise snack. Let's say you're sitting at your desk. You've been typing all morning. You're kind of slumping in your chair. You sit up straight in your chair. Put your hands over your head, straight up over your head. And then I'm going to have you open and close your hands. And I'm going to have you just open and close them as fast as you can. And just keep your arms up straight by your ears. And open and close your hands. Keep going. And I'm going to count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, so you can stop and shake out your hands, shake out your shoulders. Okay, so the next exercise snack I'm going to have you do is I'm going to have you just stand up from wherever you're sitting. And if you can't stand up, you can just march in place with your legs up and down if you're not like steady or you can't stand up. But we're going to just do 10 chair squats. So we're going to stand up and slowly lower down on the chair. Don't plop down. We're going to stand up, slowly lower down. And we're going to do 3, 4, 5, 6, 7, 8. I hope your quads are burning. 9 and 10. Okay. Now, if that's too easy for you, you could have, get out of your chair and you can do air squats, where you just do squats without sitting on something, going as low as you can with control. That would be another option for an exercise snack that's focusing on your legs. Okay, the next one we're going to do is called chest punches. And what I'm going to have you do is you're going to just like a fighter in fighter stance, you're going to just cross your arm across and punch your arm out. And you want to do it controlled, and you want to extend your shoulder as much as you can, kind of stretching your upper back. Okay, so we're going to do 1, 2, 3, 4. Try to engage your core. 5, 6, 7, 8, 9, 10. Okay. So those are like 3 examples of exercise snacks. You could also go against a wall and do some wall push-ups, or get on your knees and do some push-ups on your knees, or regular push-ups if you're strong enough to do regular push-ups. You could do some ankle circles. You could do some arm circles. But basically doing things that move your body and can also be a form of body weight strength training. Some people also keep weights by their desk, like little small weights, and they might do chest punches with the weights in their hand if they're strong enough. It's always good to start with body weight first, and as you get stronger, add weight, after that. So basically, I was talking about this log, move, lift, eat, sleep, that this is a great way to keep track of your exercise and to do the things that can support your exercise. Okay, you can go to the next slide. These are some helpful equipment for patients that are just getting started. Exercise resistant bands can be really helpful. A yoga mat can be really helpful for stretching or doing exercises on the floor, body weight exercises. And then there's these stackable dumbbells, which go from like 3 pounds up to like 60 pounds, but they go in 3-pound increments or 5-pound increments. And these are really great because they don't take up a lot of space and you don't have to buy a lot of equipment, but they're a great way to have dumbbells to do exercise. Next slide. Addressing barriers, because people do have barriers to exercise. This is something that I just like to tell people, is just to set a workday walking routine. Get out on weekends or into nature whenever you can. Increase your workout intensity as you get stronger, and pay attention to your rate of perceived exertion, because if something you're doing is really easy, that's when you should try to pick up to get to moderate rate of perceived exertion. And to find a partner to exercise with, because that actually helps with motivation and connection. Exercising at home is good sometimes for people, and trying a DVD or an internet-based fitness program can be a good way to exercise. And some people joining a gym or working with a fitness professional if you have the means. Using measurement tools like pedometers or your phone or an Oura ring or a Whoop strap. These all have been shown to be helpful because it helps people track what they're doing, makes them more aware, and can decrease BMI and hypertension. Next slide. It's important to warm up and cool down. Sometimes a warm up could be just trying that same activity at a lower intensity before you get to the higher intensity. You want to increase intensity gradually, and pay attention to that rate of perceived exertion, because if you're feeling like it's too hard, maybe you should back off a little bit. If you feel like it's too easy, maybe you should up it a little bit. And be aware of danger signs, medical danger signs like chest pain, dizziness, unusual shortness of breath. Everybody's short of breath if they're working really hard, but if it's unusual for you or you're barely doing anything and you're short of breath, then that might be something to seek medical attention about. And then be aware of environmental conditions. Next slide. These are some caveats and special considerations. Adults with chronic conditions who cannot follow the aerobic activity guidelines should just be as active as they can. Any activity helps. 2 minutes an hour helps. Adults who have chronic conditions should do resistance training 2 to 3 times a week on non-consecutive days, so not all in a row, to give time for rest as much as possible. If unable to do the full amount, that's fine. Doing a smaller amount is fine. But even a person who's not strong enough to go out walking, they could sit in a chair and do strength training and get stronger, or do chair marches, or do those exercise snacks. And then they might be able to get up, and then they may be able to move around more. And then they might be ultimately able to go walking if they get more muscle mass and strength. One continuous session or multiple smaller sessions count. So for example, 3 10-minute walks would equal 30 minutes of exercise. I put 2, but I meant 3. And pregnant women can exercise, but should avoid contact sports or sports that could cause trauma to the mother or fetus. So these are my reflections on exercise. The great news with exercise is that a little bit goes a long way. And being less sedentary is beneficial. And the highest benefit of exercise is in people who go from doing nothing to doing something. There's no minimum amount of movement that is, there's no minimum. And it is additive through the day. So 2 15-minute walks is just as good as if you go out and walk for 30 minutes straight. Try some exercise snacks, especially if you're sitting, take a break and do something even for 2 minutes. Small amounts of strength training help to build confidence to do more. And strength training improves muscle strength so that one can more easily do aerobic exercise for cardiovascular fitness. Next slide. These are I just love these guys. The guy in the middle, and I love the woman lifting in her dress, because sometimes I come home from work in my clothes and I'll lift in my work clothes. You don't have to have fancy exercise clothes. Next slide. I just want to have a shout out to my partner in Survivor Strong and Dave Spitz, who's a USA Olympic weightlifting coach and the owner of California Strength. He coined this phrase to never do nothing when it comes to your body and for exercise and strength training. And I think this talk, I hope if it didn't impart anything more to you, to always do something, even if it's a little bit. Never do nothing. Okay, I'm going to stop there and we'll take questions. Okay, so
Thank you so much, Dr. Marshall. Hi, everyone.
You're welcome.
My name is Julia Burns, and I am an administrator for OsherWise, and I just wanted to kick off some Q&A. Participants have been asking some fantastic questions. One that we're getting a lot is about the types of exercise. So I know you went over aerobic, high intensity, strength training, and someone was asking, is body training considered as overtraining, and what is the right amount?
So I'm not sure exactly what that means, body training, but I would say if you're doing aerobic exercise and strength training exercise, like it could be body weight strength training, such as yoga, calisthenics, it could be Pilates, it could be weightlifting, like with real weights, and some aerobic exercise. That would, to me, would not be overtraining. Overtraining, when I talk about the overtraining syndrome, is really for people that do ultra intense endurance training, like people who run ultra marathons, 50 miles, 100-mile, people that just are doing intensive endurance sports. And they might be able to do 2 or 3 of those races and then they might not be able to recover well. And that's because maybe they're overtraining and they're not allowing enough rest. This doesn't happen to most normal individuals. So unless you're doing a very intensive sport and you're doing it 7 days a week and you're not giving yourself any rest, that overtraining syndrome is not something you have to worry about damaging your telomeres. So what time is it, what's a good time to do HIIT, is somebody asked, and how long? So HIIT training is really cool because you don't have to do a long amount of HIIT to get a benefit. So you can do as little as 10 minutes of HIIT. It could be 40 seconds on, 20 seconds off, 40 seconds of intense activity, 20 seconds of rest. It could be 30 seconds on, 30 seconds off. It could be a minute on, a minute off. Depends on what you're doing. But that getting your heart rate up and getting the intensity way up and then having a moment of rest and then doing it again, as little as 10 minutes gives you that really big benefit, which releases all those myokines that help your muscles, brain, heart, vascular system. And when to do it depends on the patient. Some people like to exercise in the morning. Some people like to exercise in the evening. There's not a right or wrong answer for that. But if you're somebody who has a hard time going to sleep, doing it right before bed is not a great idea. Some people can exercise right before bed, but some people that will wake them up and then they can't sleep at night.
And what do you think the appropriate amount of protein in a diet should be? You mentioned not having an excess amount of protein, and then also the benefits of taking supplements versus getting your vitamins and protein from food products.
Yeah, those are really good questions. I really feel like from a health perspective, it depends on what you're doing with your exercise. So if you're doing intensive 6 days a week, really heavy weightlifting, you're going to need more protein than somebody who's just doing moderate exercise during the week. So if for normal people that maybe are doing 2.5 hours of walking or running, and then maybe doing 2 episodes of strength training a week, the range of protein depends on your age, but it also depends on how much strength training you're doing. So 0.8 grams per kilogram to 1.2 grams per kilogram is the kind of answer from all the studies for normal people. People that are over the age of 65 do need to eat more protein in order not to lose muscle mass. And so they would need to go on that higher end of the scale, and they may have to eat more variety of types of foods in order to get enough protein. Because a lot of times as you get older, your appetite also goes down. And then what was the second part of the question?
Supplements versus getting food from, or getting supplements or proteins from food products.
Yeah, I'm really a fan of getting it from food when you can. There's a lot of supplements that can cause cancer. And so I'm not a big fan of just taking a bunch of supplements. Using some protein powder, if you need to do that to be able to get enough protein, is fine. But if you can get it from food, especially there's a lot of plant-based sources of protein, and there's also animal sources as well. I think it's always better to get it from food if you can.
Some people are asking about tests and machines that can measure bone density, like a DEXA machine. I guess, do you have any thoughts on those?
Yes. You can get it like a bone density that talks about your bone density only. In medicine, that's usually what we get when we're looking for osteoporosis. But there are these body composition DEXA scans that can tell you what your muscle mass is relative to fat mass. They're relatively inexpensive to get one of those tests. And I think they're useful for someone who, if they are motivated to change their body composition, it might be something that you can measure. So you can get one, go on a program for a certain amount of time, get another one 6 months later, 3 months later, however often, you're the person that's helping you with it. I think it's like motivating to people when they can see their body mass, their body composition change. So it says, can we eat nuts during the 13 hours? No. So fasting overnight, if you're going to do that for metabolic health, you basically would eat your dinner. You don't have a midnight snack. 13 hours later, you can eat your breakfast. And you could eat a handful of nuts to break the fast. If you don't want to eat a big breakfast, you could do that. And it's really like 12 to 13 hours. It's like if you can't go for 13, you can do 12. And fasting is good for your health if you do it properly. There's another question in here. Is fasting good for your health? It is if you do the overnight fast, but it's not healthy for most patients unless you're doing massive amounts of strength training to do that 16-8 fasting. That's real popular in the fitness community because you lose muscle mass. That's the problem with it.
We're getting some questions now on what are the supplements that can cause cancer.
So there have been studies looking at like taking beta carotene supplements to prevent lung cancer. The patients that took it in that study had a higher rate of lung cancer. Or taking vitamin E supplements to prevent prostate cancer. The patients that took vitamin E had a higher risk of prostate cancer. In the Netherlands, they've done studies looking at taking folate, and they had a higher risk of colon cancer. So the thing about supplements is that it's not that your body doesn't need the thing you're taking. It's just that you could probably get it in food, and your body's really intelligent, and your body will take what it needs, and then it will get rid of what it doesn't need. And if you take a supplement of it, it might be too high in the blood and just skew the cells like in a weird direction. So I think food is always the best way to get your nutrition if you can.
Someone asked about, they've read that cancer patients require higher levels of protein. And could you talk about that a bit more?
It depends on what kind of cancer you have. So if you have sarcopenia from cancer treatment, and if you have wasting, what we call cachexia, which is when your body's wasting from your cancer, yes, those patients do require more protein. And you might be getting a treatment for your cancer that also causes a lot of cell breakdown. Like, let's say I have a head and neck cancer and I'm getting chemo and radiation, and I have a lot of, like, I can't swallow very well. And I might have to have high protein supplementation during my treatment to support my cells to be able to recover. But not all cancer patients need really high levels of protein. Like, I'm a breast cancer specialist, and, patients that are of normal body weight who are exercising and eating a healthy diet, they don't need to eat excessive amounts of protein just because they're a cancer patient. In fact, they shouldn't.
Someone asked, can telomeres be lengthened indefinitely? And if so, what does this mean for increasing lifespan?
So I'm not a telomere expert, but telomeres cannot be lengthened indefinitely, but a lot of lifestyle choices that you make can influence whether they get shortened prematurely. So, like, exercise lengthens the telomere. Certain things that you eat, like if you eat a high fiber plant forward diet, anti-inflammatory diet, that lengthens your telomeres. Stress shortens your telomeres. Depression lowers your telomeres. There's a lot of things that can mess with them. There's a really great book called The Telomere Effect, and it's written by the women who won the Nobel Prize for telomere, their telomere work. So that's a great thing to read, to learn about what can you do with your lifestyle to protect your telomeres. But exercise is actually one of the biggest ones you can do. And it's, not toxic.
Right. Someone's asking, can Pilates be as effective in building strength as weightlifting? And to me, this feels like a broader question of ways to build strength that aren't necessarily pumping iron.
Absolutely. You can use Pilates and yoga and your body weight to build a lot of muscle and to build a lot of strength. You do not have to lift weight. But you have to do it regularly. And then you also might want to challenge yourself. Like, if something's really easy, you might do more repetitions, or you might ask your instructor for something that's a little more advanced because you're getting stronger. But yeah, Pilates, yoga, That's why I threw that slide in about mind-body practices, Pilates, yoga, Tai Chi. Those are like great ways to build strength. I mean, I'm an Olympic weightlifter. Like, I've never been in the Olympics. Let's make that clear. I'm just like, I just compete in Olympic weightlifting, and I do yoga, and it is like a great way for me to balance out the little muscles that are, maybe there's little muscles I have that aren't that strong, but that really gets me to be able to be more balanced, and it makes it safer for me to lift weights. But I could just do that by myself, by itself, and that would be a great form of strength training.
What would you say to someone who's maybe ill and doesn't have much mobility? How can they implement some of these strength training exercises and exercise?
So they can do things in the chair, and oftentimes you could ask your doctor to refer you to physical therapy. Sometimes physical therapy can even come to your house and tell them you want to work on basic body strength. So like, for instance, let's say I can't walk around my house, or I walk around with a walker. Let's say that's how, like, I'm maybe weak or ill. I can potentially do just with my arms. It's kind of like lifting weights. It's, pushing my arms above my head, or marching in place on the couch when I'm watching TV, marching my legs up and down, or just straightening my leg out and putting it back down on the floor, like 3 sets of 10 on both sides. A physical therapist could help someone like that learn exercises they can do while seated that could increase their strength. And then maybe as your quads or your legs get a little stronger, you could walk around the house a little more. And you can get into this victorious cycle. I like it to call it the victorious cycle, where something you used to not be able to do, you can now do it because you did exercises that built your strength. And anybody can do that, even people that have brain tumors, that are in a chair, that their right side of their body doesn't work right. They can actually do strength training that can help them be able to be more mobile.
And in a similar realm, someone with poor balance was asking about exercise recommendations for them.
So that would be like maybe exercising in a chair, or maybe exercising, if everybody can see me, let's say you're doing something, like touch the table, be next to the table to do the exercise so that you're not going to fall, or have a family member near you and you could still be next to a table to do whatever the exercise is so that you don't fall. But people that have bad balance can improve their balance. Our brains are really good at healing if they have the right stimulus. You can make new neurons, you can make new, you're going to hear Dr. Eisenberg talk about neuroplasticity, the way that our body can heal itself and improve itself with the right stimuli, whether that's diet, sleep, exercise. But people can actually get better in their balance and their strength, even if they're pretty weak.
We'll take one more question here. Someone asks, do you recommend sauna and or cold plunge as part of an exercise regimen?
I actually feel like sauna and cold plunge are really interesting because they're ways to cause metabolic stress in the body, the same way that exercise causes metabolic stress. You know how I said that exercise can damage certain cells, cause a stress response, and then the body like reacts to that by healing itself, getting rid of damaged molecules, making antioxidants. Well, cold exposure it's like a kind of stress on the body that's healthy, and it can actually help what's called fat browning, where the white fat, you get more brown fat instead of white fat, which is more metabolically active, has more mitochondria. And then heat can also make you sweat and it cause detoxification, so you can get rid of toxins through your skin. And it's also a form of stress, which can activate those same repair mechanisms within the body that exercise does. So yes, I think that it's an interesting thing to do. I think you have to be careful. If you have cardiovascular disease, you shouldn't necessarily go in a sauna unless your doctor says you can. If you have a heart condition, maybe you'd have to be careful about doing something like that. But if you're a really normal, healthy person that doesn't have like a cardiac or a neurological condition, those things can be adjuncts that can be helpful. They do not replace exercise though. I hope that you will try some exercise snacks while you're sitting at your computer and try to move a little more. And now you have the reasons behind why you should do it. And it's not about what you look like. It's your metabolic health that's important. Okay, good night, everyone.